Good day everyone, I am Sheena Lagumbay and today I am going to demonstrate the proper donning of gloves or open gloving and removing of the gloves. Okay, open gloving is the process of wearing gloves in a proper way in order to protect the hands from any substances that may contaminate. The purposes are, first, to protect the hands of the health worker, to be able to touch any sterile objects without contaminating them, and second, to reduce cross-contamination from nurse to patient or vice versa. Its principles are: do medical hand washing before and after the procedure. Second, wearing and removing of gloves by skin to skin and glove to glove. Third, proper disposal of gloves. In planning, secure the appropriate size of the sterile gloves. Sterile gloves is our only equipment. It is for us to be able to use well-fitted gloves. Also, check for the expiration date and do not use if the package is damaged. As medical technologists, we perform venipunctures a lot, and it is very important to don gloves as they provide excellent hand protection from blood drop on a patient's arm. So the first step in this procedure is to explain to the patient what are we trying to do and why is it necessary. So for example, good morning, ma'am. I am Sheena Lagumbay, your medtech for today, and I am going to draw blood from you through venipuncture in order for us to obtain your ordered test. So by chance, are you allergic to latex gloves, ma'am? Okay, that's great. If a patient is allergic to a sterile gloves, then we may opt to use different type of glove like nitrile gloves. Ma'am, sterile gloves are used in many procedures like this, the venipuncture, as they maintain the sterility of the equipment and protect your wound. Okay, I am also done washing and drying my hands also, so this is to reduce the microorganisms present in the hands. Shall we start? Okay. In donning gloves, we must first place the sterile glove package on a surface above the waistline. That is because anything below the waistline is considered unsterile. Next procedure, open the outside wrapper by peeling the top layer back. Remove the inner package, handling only the outside part. That is to maintain the sterility of the inside part of the package. Next, lay the inner package on a clean and dry surface. That is because any moisture on the surface can contaminate the gloves. Next, carefully open the package, the inner package, and expose the sterile gloves with the cuff end closest to you. The inner surface next to the sterile gloves will remain sterile. Then, with the thumb and the forefinger of our non-dominant hand, grasp the top edge of the folded cuff of the sterile gloves for dominant hand. By touching the inside portion of the sterile gloves, contaminating the outside is avoided. Next, lift, step back, and hold the gloves with the fingers down. This is to avoid touching any unsterile objects. Next, carefully insert your dominant hand to the gloves by pulling the glove. Leave the cuff folded until the other hand is gloved. Then, slide the fingers of the gloved hand under the folded cuff of the remaining second glove and lift upward. So this prevents the accidental contamination of the glove by the bare hand. Then, carefully insert your non-dominant hand into the glove by pulling the second glove, holding the thumb outward as much as possible. In this position, the thumb is less likely to touch the arm and become contaminated. Then, adjust the gloves on both hands, touching only the sterile areas. This is for comfort and ease. In removing the gloves, we must first, using your dominant hand, grasp the other gloved hand near the cuff and remove by inverting it, keeping the contaminated part on the inside. Continue to hold onto the glove. This keeps the soiled parts of the used gloves from touching the skin of the wrist or hand. Next, slide the first two fingers of the ungloved hand inside the remaining glove. Touching the outside of the soiled glove is avoided. Next, grasp the glove inside and remove by turning inside out over the hand and the other glove. So this reduces the chance of transferring any microorganisms by direct contact. Discard the gloves in an appropriate container. This for proper disposal of the soiled gloves. Then do hand washing. This is to reduce any possible microorganisms.